We are back with our regular segment that we bring you each Tuesday here on the program from the Saddleback Memorial Foundation. And joining us today is Marguerite Fusco, RN. She's the clinical coordinator for the Wound Center, a part of what goes on with Saddleback. And Marguerite, welcome to the program today.
Thank you.
You know, a lot of times we'll get a cut or a scrape or a bruise, and, you know, a few days, a week or two, it heals up, and we kind of maybe have a little scar there, but it goes away and we forget about it. What you folks deal with are wounds that persist for longer than a couple of weeks. They don't heal. And that's where you folks come in at the Wound Center.
Exactly. Wounds that show signs of healing in 2 weeks aren't a problem, but if it goes beyond that, 2 weeks and no signs of healing, or a wound that's not completely healed in 4 to 6 weeks, is where we come in.
Mm-hmm.
There's an underlying problem there that's...
Right. I know our moms always said, just wash it with soap and water, put a little either Bactine or something else on it, and, you know, it usually goes away. If it persists, I guess first see the family doctor, or should they come to see you immediately?
Ideally, they should see their family physician first, be referred to our center. If that's not possible, they can certainly just call the center, make an appointment, and refer themselves.
If they're concerned if something looks like it isn't healing up appropriately. You folks have been open less than a year, but I know you've got a lot of the state-of-the-art facilities down there. Really, it's an adjunct to our family doctor and the specialists that we all see. You have a lot of different ways to deal with wounds, I guess, depending on what type of wound it is. What are some of the techniques you folks are using? Some
of the techniques we're using are biodebridement, which is maggot therapy. We have...
Wait a minute. Maggots, those creepy little critters that suck your blood?
Exactly, exactly. However, they're specifically made in a lab. They're not your typical maggots.
Medical maggots?
Yes, they are medical maggots. They are very, very effective in debriding. The doctors also do aggressive debridement, sharp surgical debridement. We use bioengineered tissue, which is live tissue. We have the latest, the newest dressing medications for wounds. The doctor sort of customizes the treatment according to the wound and the etiology of the wound.
Mm-hmm. Obviously, if somebody comes in with a wound that isn't healing, you don't just start treatment right away. Obviously, there's probably some kind of test that you do, procedural, before you get going.
Yes, we do a full examination on their first visit, including testing and review of history. The team collaborates with the primary physician. We figure out what's causing the wound not to heal, and then our plan of care is made from there.
Right, so you analyze the problem and find out what the source of the lack of healing is before you really fix it.
Yes.
Right.
Yes.
You're not on campus here. You're a little bit away from the Saddleback Hospital, but you're very close and you have good transportation, I understand, available as well.
Yes, actually we do. We have free transportation from Saddleback that we set up for the patient. If they're unable to get transportation, we set that up for them to take them to and from their appointments.
I know a lot of people are battling diabetes, and I know that's one of the areas where a lot of times people do have wounds. They may not even be aware they have, and suddenly they realize there's something wrong with their feet or something wrong with some other part of their body. Is that one of the main areas that you get referred from?
Yes, it is. And we deal with very many diabetics. We also collaborate with diabetes education from Saddleback. We can bring them in, do education for the patient, tell the patient what to look for, how to prevent diabetic foot ulcers.
Right. Sometimes people who are bedridden get sores, and some of those kinds of things need your expertise as well. I guess things like the shoes that don't fit correctly, a wheelchair that isn't appropriate, these can all cause wounds that would send people to see you.
Yes, and we deal with every kind of wound. We have all kind of options and treatment modalities, and the doctor evaluates, the nurses evaluate what causes the wound, where do we go from here to eliminate the problem and heal the wound.
One of the biggest fears that diabetics have, I know, is the fear of amputation. I know you have a story of one of your patients who actually was told that was the option, and they made the choice to go see you folks and were able to save that limb.
We do. We actually had an elderly couple. The wife came to us. The other physicians recommended amputation, and we were her last chance for something, savior of her limb. We started with the biodebridement, and we put her in our hyperbaric chambers, and the woman is healed. The woman just came back from a vacation cruise in Hawaii.
Excellent. A good way to celebrate that,
Yes.
that healing. Well, some great things are happening over there. And again, if you have a wound that just doesn't look like it's healing up correctly, whether it's caused by diabetes or some other matter, check with your doctor or see if the wound center may be appropriate for you. And obviously, there's good collaboration between you folks, your physicians, and the person's personal physicians to coordinate the care as well.
It's a team effort, yes. We have caring physicians, experienced nurses, hyperbaric technicians, and we all work together to heal the wounds.
Great. Wonderful program. It's fairly new here. We thank you for sharing it with us on the show today. Again, that's all part of the good services brought to us by Saddleback Memorial Hospital and Medical Center, and of course, community hospital serving this community for a good number of years. We'll be coming right back with more right after this timeout.
From day one, it was clear this active retirement community needed a hospital.
And today, Saddleback Memorial, a nonprofit, state-of-the-art medical center, provides excellence in healthcare for you and for me.